A very good morning, everyone. Greetings to the guests of the dais, Mrs. Judy, Mrs. Victoria, Mr. Kevin, Mrs. Derita, Mrs. Sunita, Miss Shruti Dayanand, and Miss Rosalie Jose from Padamala College. It is also my honor to welcome the principal of Sridevi College of Pharmacy, Dr. Jagdish V. Khan. It is indeed my pleasure to welcome the faculty members of Sridevi College of Pharmacy on board, Mr. Pramod Bhaskar Kumar, Mrs. Rihab Thompson, Ms. Shehnaz Patni, and Mr. Baiju Naik. Last but not the least, I welcome all the participants who have gathered here for this training program. I would now humbly request our principal, Dr. Jagdish V. Khan, to say a few words.
Very good morning to all of you. Sister Judy, Mr. Ashwin, faculty members, all the faculty members of Abdominal College of Nursing, our active NSS volunteers, both the teachers as well as students, and the active participants who have come here. Very good morning to you once again. We are very much grateful for the nursing department of Abdominal College of Nursing today for accepting our invitation and to share their valuable time with us to actually participate in this NSS activity and to train our volunteers regarding the emergency skill. I was talking to Mr. Ashwin. Their aim is to train many people outside the health sector also. In that way, recently they had a program in ITI college. So many people are trained there. So whenever more number of people are trained, it will be helpful for the public so that this cardiac arrest problems and all can be corrected at the same moment. Because of the corona, now the enthusiasm of our students is not that is more activities, NSS activity we could not do since 2 years. Now, by the grace of God, the third wave is not very severe, it is very mild. It is pandemic has become endemic, and it has become almost like a flu cold type of disease. So the casualties are also reduced. So in all the colleges, now the activities, not only the curricular activities, extracurricular activities, will be enhanced, it will be improved. It was reduced to zero from past 2 years. So I once again, welcome to all the faculty members, the HOD of Father Muller's College of Nursing to our institution for training our students. Father Muller's is a charitable institution. I think it started about 135 years ago by Father Muller's in a small clinic, homeopathic clinic. That's what I heard. And it has become a gigantic organization now. And it has got the fame and name because of the systematic way how they run the organizations. They have many institutions which are, maintaining very good quality, and it is one of the best institutions in the Karnataka. And they serve the people really. They get patients not only from India, Karnataka, they get patients from abroad also. They have service mind. That is why they could get the reputation from the public. Our MSS team, we have around 100 volunteers. They were very active earlier. As I said, because of the corona, the activities are reduced now. Once again, we have to start now. These skills, what we are teaching now, demonstrating here, the emergency skill, it will be definitely useful to our students, and our students can teach others also, people who are not in the health sector, so that it will be really reaching the public. Because of the corona, out of 10 people, 9 people are dying. That's what she was telling. This rate can be reduced if more and more people are getting this training. I hope the program will be successful, it will be grand, and it will be really useful for the public. With these few words, I end my talk. Thank you.
Thank you, sir. I would now like to request Sister Judy to address the students.
Respected Principal Dr. Jagadish Kamath, Sridevi Pharmacy College, Mr. Pramod Bhaskar Kumar, Coordinator, Department of Pharmaceutical and Chemistry, Dr. Shahanaz Praveen, Department of Pharmacy Practice, Mr. Tons, I have Mohammed Ali, assistants, and here with people, so Department of Pharmaceutics, and Mr. Baiju Matthew, Department of Pharmaceutical Chemistry of Sridevi College of Pharmacy, and other delegates on the dais, and Mr. Ashwin, Department of Medical Surgical Nursing, Father College of Nursing, the faculty of Sridevi College of Pharmacy, my colleagues, students from Father College of Nursing, the participants of today's training program. Good morning to all. Before we begin, I thank the Almighty God, the Creator and Sustainer of our life. I'm extremely delighted to make a note here on this training program about emergency life-saving skills. On behalf of Father College of Nursing, we extend our gratefulness to the organizers for inviting us today for this event. And also now the Principal Dr. Jagadish have verbalized about Father Muller's. Thank you very much for your kind words. Your diligent effort and passion to enlighten the mind of the students with such practical medical knowledge is really praiseful. Life is precious, but quite uncertain, as usually unexpected happenings occur. When an individual's life is at risk, we may get panic due to lack of necessary life-saving skills or techniques. Mindset of an individual is very important on the process of saving a life in an accident. It requires thorough knowledge about how to do, what to do and how you can do it without fear. Millions of people are at risk of reaching mortality and morbidity due to inadequate or delayed assistance at the time of accidents. Therefore, emergency life-saving skilling is an urgent need of the hour. I'm pretty sure that you shall become a real army at the forefront of any accidents by saving the lives of the people to the profound skill which you are going to acquire through this training program. I wish you all a good learning experience. Once again, we share our feelings that we are privileged to be here in Sridevi College of Pharmacy for the training program today. Always remember, safety is first aid to the uninjured, and first aid is a safety to the injured. Be safe, act fast, save promptly, and save life. Thank you all.
As we come to an end of this inaugural function, I thank you all and have a wonderful evening. I now hand over the session to the team of Abdominal Thrust. Thank you.
Morning, everybody. We should start with what is first aid. It's a very familiar term, right? Something which we give as an aid at the beginning, that's called as a first aid, which makes a difference. So, now brief, we'll talk about first aid, and then we shall go into the main components of today's discussion. So, first aid is a temporary immediate assistance. I told you, something which we can do it outside the hospital immediately. We not to wait for the doctor to come or the hospital people to come. Immediately we can do. To any person who is injured suddenly becomes ill, facilities or materials available with very much alarming. So to preserve life, that's the main purpose. We have to do first aid on the spot where you encounter, to prevent the further complications, to make the patient very much comfortable before we shift to the hospital, and to hand over the injured or sick person to the right place. That's why we need the first aid. There is something called as golden hour. Every patient, every disease condition has got golden hour. Within that time, if you shift the patient to the hospital, we can save him. Most of the media might have been said, you have brought the patient at the right time. Greetings to you, thanks to you. So that golden hour, we can make a difference if we do with the first aid, and we can reassure the victim. Thing to be kept is we should not avoid, we should not handle the victim unnecessarily, because possibilities of further complications or injuries if you handle unnecessarily. So first aid will preserve further complications before shifting the patient, and as I told you, safely we can ship the patient to the hospital. So that the hospital will take over what is needed. In the first step, keep that in your mind. Check for breathing. Very simple. We all can check for ourselves how the patient is, how you and I are breathing. Breathing, check for the breathing and check whether any bleeding is happening or blood flow. We call it as hemorrhage. So check for the bleeding. And third is, if there is any bleeding, try to control it. So these things you just have to check over. Well, make sure the scene is safe. Right? Probably you can see some wires, you can see some thread to you so that you make sure scene is safe. In the railway station or in a track or in a lift. And then you can do what is gain access. Go near the patient and do something what you can do near the patient and ask from the bystanders or people who have seen the scenario first and get the information so that you can analyze what is that situation and react accordingly. And check the vital signs, whether your pulse is there. Right? We will teach you later how to check the pulse, whether the person is breathing, right? Whether the person is conscious. So those are the basic vital signs you should determine before you go further. And after determining whether the person needs emergency care, you can perform necessary steps in a sequence of order. A, B, C, and then one more thing is B, or we can say as bleeding control. So A for airway, and B for breathing, and C for circulation, and one more B for bleeding control or hemorrhage stop. So these steps you keep in your mind always, go sequentially so that you can preserve the life. And finally, doing all these things, you can ship the patient to the nearby hospital. There is something called as first aid kit, which every institution should have. Probably the NSS team can see to it what all first aid kit you can have in your hospital. So that will have all the collection of supplies and equipments which can help you in immediate medical need. So you can probably buy that in a medical store, or you can, or else you can consult us, will help you how to get those things in the first aid kit. Probably you can keep that in a plastic box. The next slide will show you. You can keep it safe and secure and reachable. Anytime you can take that and use it. That's how we can keep a first aid kit. You can open and keep it. You'll have some articles. You're ready. You not to be panic. You can pick up some important phone numbers in the first aid kit so that anybody can access those phone numbers and get the immediate help before you start the resuscitation, before you start the help. You can also maintain the contact numbers of the hospital nearby. There are a few things which we can have in the first aid. Everybody can just take one point what is there in the. Quickly let's start. What is there in that? What are things we need? What are things we need? A bandage, okay, fine then. Gauze. Some solution fix can be used antiseptic then. Thermometer to check the temperature, especially COVID times. Cotton to stop or to clean up them. Scissors to cut, the bandage is fine. Gloves to protect ourselves, to pressure them. Yes. Ointments. Ointments, yes. ORS drinks, energy drinks to be kept, especially if it's a sports day. You buy so many things and go there. What else? Yeah, we can have some hemorrhage control measures. In later classes will show you. Long cloth or dupatta or something like a hard stick which can be rolled around, stop the bleeding, and much more. So with that, we are done with the introduction of what is first aid. we will go on to the CPR. How many of you have seen CPR in your eyes? Indirectly with the mobile phone or in the television or in the movies. Please keep your hands up.
Raise your hands.
I always ask this, how many of you have brought your hands today? First thing at the first I'll ask, then only I'll ask, can you see that? Okay. Okay, how many of you have not seen CPR at all in your lifetime? Good, good. Faithfully, one person is raising the hand. Okay, one, two, couple of people. Before we start, I think the pre-test, of your fall. Okay, pre-test. Everybody got a pre-test?
Yeah, we will.
Pre-test. Just open up your WhatsApp group and take up the pre-test. Yeah, we'll just wait for 2 minutes so that you finish your pre-test. Don't worry, just wanted to analyze. Nobody is going to come back to you and ask why did you fail in the exam. Just to make you feel that what is your need for this day. Take up your phone. If you don't have, we'll send it to you. If you don't have,
I'll just send
just a Google form format.
I'll just send it, sir. Wait a minute. I'll send it.
If you have not got the pre-test, please raise your hand. We'll help you.
Wait. Yeah, sir. I'll be doing it. Or do we help? Anybody else? Class? Yeah, I'm sending.
Yeah, make it fast. Once you get it, make it fast.
Yeah.
Once you have done, we will start for that.
You can send it in your class. Everybody can. Everybody have received the Google form?
Yeah, we're going to wait for some more minutes to finish up your pre-test. Please do it fast. Hope you are making up the pre-test, and also remember that after the session, you also will be given the same link to post-test, so you can keep up your response. Remember, both pre-test and post-test has to be done by you. If you have not done it, make sure you are doing it before we go from this place. How many of you get to do? Raise your hands up. Get to complete. 27 has come. 28 has come. 70 participants. 28 has come. 32 more left. Okay, 4 responses we have got. Few more left. Few more left. See some. We'll add 3. Make it fast. 15. Fine. We've been doing it, right? Okay. We should start. So, we're going to start with the Cpr session. What is cardiac arrest? We're going to see these questions. What is cardiac arrest? Why we have to give CPR? And what is the sequence which is prioritized? Prioritized sequence which you have to do in CPR, and how to do those steps in CPR, and a little bit of the role of a shock in a patient who has cardiac arrest. So these are the things which we are going to hear first, and then we are going to divide ourselves into groups and then practice. Ready? Yes. What is cardiac arrest? Very simple to understand, right? When the heart is arrested, the heart stops its function. There is a moment heart will say enough, I'm not going to function further because I'm tired, I'm complicated. That is called as cardiac arrest. How do you say the patient has got a cardiac arrest? No pulse, no breathing, no consciousness. These 3 are there. You can very well say it is called as cardiac arrest. Any doubts? What is cardiac arrest? Very simple. No pulse, no breathing, patient's consciousness is altered. It's alarming that almost 5,000 of population in 1 lakh has cardiac arrest. Somehow they get cardiac arrest. 1 lakh population, 4,000 plus patients get cardiac arrest. Is it alarming? 5% in 100. And out of the 5%, around 5,000 patients, 112 patients die because there is nobody to take care of them when they are having cardiac arrest. Right? 112 patients die every minute because of cardiac arrest. And something which we have to keep that out of the 112 patients, 85% of patients die outside the hospital. So who's outside the hospital? We are outside the hospital. You, your friends, your extended people are there in the outside the hospital, in your railway stations, in your hostel rooms, in your classrooms, in your playground, in your laboratories, in shopping malls. In those places, only you are there. So 85% of cardiac arrest happens outside the hospital. Time is very important when we are acting on a patient who has cardiac arrest, because every minute you start early the chest compression, 10% of the patient's survival getting better. 10% of neurological, the brain function gets better. Every minute you start the chest compression earlier. So need not to be panicked, need not to be worried. The moment you go there and see a patient unconscious, moment you start your chest compression, you are increasing 10 minutes of the patient's survival. Happy about it, right? No? You know about this person? Who is this person? Yes. Missile man of India. You know how did he die? Cardiac arrest. It was shocking for me to read up yesterday. He collapsed and fell down on the podium, on the stage, when he was about to stop. IIM means Indian Institute of Management. He collapsed. There was nobody to the resources. The publication says that there was nobody to do the resuscitation measure. He was brought to the casualty dead. He was brought to the hospital dead, and the doctor declared that he died because of cardiac arrest. So in the year 2015, July 27 is declared to be the CPR day. So CPR day is July 27, 2015, because we have lost the missile man on that day. Most of the people say that I do not know what is CPR, that's why I am panicked. That's why I do not go to the spot. That's why I do not want to do. But you and I, your friends, should not say that I do not know. What will you say? What will you say? I know, so that I can save somebody. Can I see your hands up? Right hand up and say, I know. Why not look at somebody else got your right hand? I know. Yes. First thing to be, I wanted my friends, volunteers to be on stage. As I talk, they're going to show something. If you're not following it, don't worry. When you are divided into groups, you will be detailedly explained. Don't worry about it. Just as I talk, they'll be just showing something. Right? The first thing to be told is, first thing to be understood is, see, whenever you go there to the spot, make sure that you are safe, patient is safe. Second thing is, recognize the cardiac arrest. We'll go step by step. Right? They'll be prepared on stage. Recognize the cardiac arrest through primary assessment. They'll show it. And call for the help. You must be knowing what is the help number, right? What is the number? How many of you have dialed that number? Anybody has dialed that? How many of you have dialed 100? Police? No helpline numbers? Okay. See, when you dial, you will get nervous. I'm telling you. You will get nervous what to speak. You will get nervous what to say. Sometimes we say everything, but we forget where is the place. We say everything. We say person name, student, college. And we don't say that, we just participate. I remember shifting a patient from a COVID ward to the hospital. We had to say so much to the ambulance driver because he has to locate the remote location. Very difficult to call. So we need to prepare ourselves to call until 8. And remember that early chest compression. Every minute you go first and start 10 minutes of survival, you are increasing. Every minute you are delaying 10 minutes, you are making your patient go back. It's in your hand. Then the minute the golden hour, you want to start first or not. An early shock and early shifting the patient to the hospital. Right? The first thing to be analyzed is scene safety. Probably you get in a situation like this where the electricity pole has fallen down, you get a cardiac arrest there. Or you may in a situation where there is the main road, right? For many years back, decades ago, we had an aircraft crash, right? Remember that? Remember that, right? Those in the college now, right? You may be in a situation to go and help. Scene safety is make sure. Scene safety is first important. Very simple. Just check whether any electricity lines are there. Whether any threat of flood is there, or you are on a track where the train can come, or in a road where the bus can come, make sure that you and your patient is away from the dangerous place. Very simple. You follow the first step. What's the first step? What's the first step? Team safety. Right. The second step is imagine that he has come here. The first step he has done is he has done the scene safety. He's doing it, make sure that everything is clear, and he's going to analyze whether it is started or not. So what he's going to do is going to do a technique called as cover, look, and feel. So he's covering the patient, no, because it is COVID. When you do CPR, chest compression, droplet can come out. So you can get COVID. So a new strategy is because of COVID is cover with your kerchief, a piece of cloth, nose and the mouth. And what is he looking? Looking into the chest. Is the chest moving? And what is he hearing or feeling? And also he is hearing and also he is feeling his hand. His hand is in your neck. You can feel your. Just move down. You have the Adam's apple. Just go across. You find the pulse. If you can't feel your pulse, please tell me. We need to check and give you cardiac arrest. You must feel your pulse. Did you feel your pulse?
Yes.
Yes. Very simple. Move down and then. So now no pulse. Chest is not moving, and we decided that patient has got a cardiac arrest. Very good decision. Yes. What is he doing? He is trying to get some help. Why need help? We need somebody can come so that they'll got the ambulance, they'll do some shocking machines or whatever it is. Always get a help in life. Right? Yes. Help. And so he is calling, the friend is coming, and he understood that there is a collapse, and somehow they talk and they call the ambulance, and he starts. So that person is going to get the help, and this person is not leaving. He is not idle. He is resuscitating immediately, because why? Every minute you delay, 10 minutes you are decreasing the lifespan of or expectancy, possibility of a patient getting his life back. So he started the chest compression. For that, he is using his heel. This is called as heel. Heel of the hand, placing on the sternum bone. Sternum, right? This is called as a sternum bone. Lower half or lower two-thirds of the sternum. If you divide the sternum bone first, or the upper bone, middle and lower two-thirds. Right? You just have to locate it. Right? Or all of you will feel one depression inside, right? Please, you all have a sternum bone. Take your right hand and feel for your sternum bone. You have a depression. Just 2 fingers above the depression is what exact landmark what I am talking about. Nothing but lower 1/3 of the sternum. Lowest, right? So he is placing the right hand heel and using the left hand clasp, join, and moving the shoulder forward, making that 90-degree, which is form of the wrist, elbow, and the shoulder. Right? And 45-degree between the hip and the shoulder. And he starts chest compression at the depth of 5 centimeter. Every time you give chest compression, it has to go deep 5 centimeter. And make sure that the pressure he is delivering only from his shoulder, not from his elbow. The pressure is coming only from the shoulder. Right? This he will be continuing with a skill called as recoiling. He press down and recoils. Systole, diastole. Systole, diastole. You are helping the heart to pump, relax, pump, relax, pump, relax. He is doing it for about 100 times per minute for continuous 2 minutes. How many times per minute? How many minutes? 2 minutes. So 2 minutes, 2 minutes. He can take a break, not to go for a tea, but to check the pulse. Right? Every 2 minutes, you can take a break to check the pulse whether the patient has got the life back or the heart is pumping back. Probably in 2 minutes time, we may get the AED coming. There is somebody who has gone for help. So this machine is called as automated or automatic external defibrillator. You will find in your railway stations, bus stands in developing country only in few years you may get it. You may get it in public places, in the shopping malls. You just have to open it and you will have 2 paddles, right? Without disturbing the CPR. This gentleman is keep on giving CPR. It's not disturbed, right? Why? Every time he delays, 10% of the survival is decreased. He's bothered about his work. And he's bothered about his work. And he is keeping 2 paddles, one on the right and one on the left. Nothing to worry, where is right? The picture is very clear. Which one to keep on the right, and which one to keep on the left. And he will switch on the machine. There is something to switch on. Once you switch on, the machine will start analyzing. Okay, what rhythm it is. Not every time the machine will give shock. The machine will know in which situations the machine can give shock. There are only 2 rhythms which the machine can give shock. Right? Fibrillation and tachycardia. You may study it later, right? So once the machine says you can give shock, he will say that I'm clear, you are clear, everybody clear. So that the electricity which is passing to the patient will not touch him. Right? He has to say that I'm clear, you are clear, everybody clear.
A blind pad has shown do not touch the patient.
It will say do not touch. But wait now. This is the only time we can stop.
Analyzing heart rhythm. Shock advice.
Shock advice, there is a button, green button.
Press the flashing shock button. Shock delivered.
Shock is delivered. Again, we starting the CPR without interruption. Interruption is only when 2 minutes is over and when the machine is telling stop CPR. I need time to analyze the rhythm. Got it right? Probably the ambulance has arrived and we have shifted the safety. That's all about CPR. Any doubts you have? We'll go to the demonstration if you have doubts. You can get me the doubts later. We are going to divide the 2020 into 4 groups and 4 different stations we have. We will learn it together. Thank you. The next session is about hemorrhage control. Right. We're going to learn how to control hemorrhage, how to split or stop. So over to our HOD Sister Judy.
Good morning. Once again, welcome to next session. After an active class of CPR, are you tired? You have got your cardiac arrest, right? Your heart is active now after the CPR. So we will move on to the next class, that is nose bleeding or the bleeding. There are various types of bleed based on the site, maybe from nose, maybe from internal bleeding or external bleeding. Maybe after the injury to the lower limb or upper limb, wherever it is, if you see a bleeding or a hemorrhage, how you are going to manage the situation, we will see. First, we will see a video, then you will understand it better way, then I will explain to you how to manage a nosebleed. This is our campus, Abdominal College of Nursing. So I not come to the Continental College of Nursing. You can see our campus. Okay, what you have observed there? What you have seen? The video. Sit. Oh, they were playing basketball. Then what happened? Okay, the ball hit on the nose and starts bleeding. Or you must have experienced in your situations that while playing, you may run with so much of force and hit on somebody's body and got some fracture or some kind of bleeding, or somebody else come and hits on you, or you may hit on the wall, whatever it may be the reason. Sometimes you will get a nosebleed. In that situation, what you have to do? First step was already Ashwin sir have explained to you, make sure that the scene is safe. Then second thing you must have observed is that what position that what is that health professional has given to the client. What position you have observed? Yes, very good observation. So head lean forward. Actually, in the beginning, once you get the hit, what happens? You have a tendency to keep the head forward, backward. You should not do that. You have to, as soon as you see a scene, you make sure that they comfortably sit the patient or the client on somewhere. So, sitting position, then second, you remember that head should lean forward. If head goes back, what happens is the blood drains into the throat. What happens? Again, blocks the breathing or airway. Then again, it will be a complication. You cannot manage the situation. Other thing, second thing is, again, if at all, if the head hits back, it drains into the stomach or you swallow the blood, then after that patient starts vomiting, then you may not be able to manage the situation. So make sure that the scene is safe. Second, that make the patient or client to sit somewhere comfortably and keep the head forward or lean forward the head. Then what you have to do, next step is apply adequate pressure on the soft part of the nostril. You can use your thumb and other finger, and if nicely you have to press over the soft part of the nostril. Like this, you have to give adequate pressure to the nostrils. It continues, persistently you have to give it. Or otherwise, if at all heavy bleeding you feel, then some kind of small pressure also you can apply over this and starts giving pressure. It continues, slowly you will observe, and if at all the bleeding doesn't stop, what you will do? How will you observe? What you have observed there? You call somebody and ask them to get the ice. You don't try. You have to call help. The Cpr also you have seen. You just ask somebody's help. Call someone and ask them to get some ice cubes and wrap in some small clothes or your kerchief or towel and apply over there for these 15 minutes. Till 15 minutes you observe the patient. If this bleeding continues, what you have to do next step? Three things you have to observe. 15 minutes are over. Again, bleeding continues with heavy bleed or gushing that you have observed, and patient shows some kind of breathing difficulty. You have to call one number for ambulance. Which is the number? 108. Then shift the patient to some of the emergency department of nearby hospital. That's what sir said. You should have some number of the hospital, nearby hospitals, emergency number you should have. That is the main management of the nosebleed. This much is clear. Then we will see another management of hemorrhage in another video. We'll see one more video. Okay, you have observed two videos, right? The first one, you have observed an injury happens during play or whatever it may be, a small injury or cut happened on the, or abrasions occurred on the hands or the upper limb. So how do they manage? And if it's a major injury, how do they manage? These are the two things which we have observed here. So what you have to do, you know that what is wound you understood. What's an injury or breaking down of the skin or abrasions, what happened again? It usually damages the underlying tissues, that is called as wound. There are various types of bleeding, maybe internal bleeding and external bleeding. How do you know that there is an internal bleeding? Okay, you can see some bluish discoloration at the site, or internal bleeding can be observed only through your pulse or deeply down, all those things. You may not be able to understand the major or unless you are a professional. Second thing, you are going to manage with the external bleeding. So once the external bleeding occurs, what you are supposed to do? First step in the both first video, what you have observed. First step, what the professional did. Most clean the area with the clean water. You have to apply the clean water and wash the area. Second, as soon as wash the area, what she did? She has given adequate pressure to the site. Okay, so if I know first aid kit is available, you can wear the gloves same time. The patient is conscious, patient, you can ask the client to give the pressure, or you have to suddenly give the pressure to the site. Second thing, you know that in the first aid kit there is a gauze. If gauzes are not available, you can use a clean cloth and apply the sun dressing over there and give pressure. Then you observe externally, is there further bleed? If there is no further bleed, fix that same dressing with the another gauze bandage and fix it. You have seen the wrapping over there with the gauze bandage. Have seen, right? So we have a tendency to observe, remove and see whether the bleeding is stopped or not. Don't do that. If you are trying to remove, what happens? Further bleeds. So if it doesn't stop, again you will have a problem. So do not try to remove the dressing from over the side. You just keep, if at all you feel you require more clothes or the other those places, you just keep over there and give adequate pressure till the dressing stops. Then along with that, I will talk to you regarding the splint. What splint they have used for that major injury? Stick, whatever it is available near you. Other than that, what you can do as a splint? Nearby, what will be available? A cardboard. Then a magazine, a cardboard or piece of wood, which is your feeling that giving adequate support to the area. It's a hard surface. You can utilize as a splint. So make sure that when you apply the splint, you should not manipulate the area. What is the aim of giving the splint? Keep it support or immobilization, but should not manipulate the area. If you are trying to manipulate, what happens sometimes, it may injure you and it may injure the nerves. So in order to avoid that, whatever is the position, you just give some splint over there and wrap it properly. So that is how you are going to manage. You should not try to do anything more than that. Only wash the area, try to cover, give adequate pressure over there and give some support and cover it and shift the patient to the this one, paramedics emergency department of the hospital. Then the last, some other examples for some splint is maybe you may fracture on your clavicle or your shoulder bone. You know that the terminology you're familiar with. So, in what you will do soon, if you get some kind of fracture or injury over your shoulder or hand, what happens? Or how you will split it? How you will tie? You have seen a triangular shape. You take your dupatta and make a triangular shape and tie your two sides on your neck and the other side will be free and keep your hand over there. That's very easy, simple thing which you can do. And next part is the tourniquet making. Another, can you just show the tourniquet? So another thing which you can do to stop the bleeding, make a tourniquet. For that, again, you can utilize your dupatta or any other clean cloth. Take a clean cloth and wrap the area with the two ends are free. This should be long enough, the ends should be the free and the loose end should be free enough to make a knot. So, wrap it properly, various kind of one after the other, you just cover it properly and make one knot near to the wound. After that, another knot you have to do, in between you keep a stick. Then tie it properly, then twist the stick. Till you feel that adequate pressure is applied. You can see over there, you see. For that, you have to have a width of 5 to 10 centimeter bandages, or your cloth should have a 2 to 4 inches of width, and make sure that that much width is required to cover a particular area. Then after that, the loose end you should have a one knot, then another knot you put in between, you keep the stick, then tie it properly, then you have to have a twisting of the stick, then thereafter you just fix it. Once you feel that, you have to give adequate pressure on this. How long you can give pressure? You may be feeling tired, so you can use this tourniquet method to stop the bleeding and place. After that, once you feel that the bleeding stops, you just keep it and place center wrap and keep it. We will demonstrate to you what is how to do a tourniquet. This is here. This is how you manage the bleeding or splint case. Bleeding is very easy. Bleeding also, don't do anything more than this. Just wash the area, apply adequate pressure, give some dressing. If at all bleeding doesn't stop, more than that, again, once more dressing you apply, cover it and fix it and ship the patient to the emergency department. Clear? Any doubts? Next, Mrs. Juby will talk on the management of choking.
Good morning, everyone. Okay. So next topic is about choking. Do you have any idea about choking? What is meant by choking? Have you heard choking? Choking food? All of you have some idea, right? So the choking happens in case of all age group, infant, child, or even in adult case. So we will have different steps how to deal with choking person. Okay. So when it comes to children, what could be the reasons for getting choked? While feeding, maybe, then while playing with toys, maybe some button or some screws or will be there, groundnuts, all those things have tend to choke in the airway. So choking is nothing, something when we are swallowing, accidentally it may obstruct in our airway. And if you are not treated, what could happen? Breathlessness. And there will be blockage in the trachea, air will not reach to the lungs. So we will be seeing, first we will see a video related to infant choking. Infant means baby within 1 year, okay. We'll see this. Observe the step what she is doing. Okay. Okay. You must have seen she is doing some action on backside as well as in the chest area. Okay. So this is exactly what you are supposed to do when a baby is choking. Okay. So here choking occurs when food or small objects block the airway. This prevents oxygen from getting into the lungs. So when an infant is choking, how you will understand the baby is choking? You may feel baby is restless and you can see that baby is not able to cry. Sometimes if the baby is able to cry, the objects may come out. And if it is there in the mouth, you can take it out. But don't seize with your finger. If you already understood that something is already swallowed and it's obstructed in the airway, you don't try to seize like this. Sometimes it may go more inside. So instead of that, if it is already visible in the mouth, we can take it out. Okay. So you can see that baby may not be able to cry, or sometimes even there is bluish discoloration around the lips as well as in the peripheral. Like if there is deficiency in oxygen to the baby, definitely the skin starts turning blue. So that is also a dangerous sign. So when you happen to see such situation, you are going to add with this 5 back slaps followed by 5 chest thrusts. That's what I say. Back slaps and back slaps or blows, and then 5 chest thrusts. We will demonstrate that also to you, so you will be familiar. So first you will be doing 5 back slaps between the shoulder blades. Between the shoulder blades, you have to forcefully do the slaps, 5 back slaps. Then you will turn the baby. These are things you can do while keeping the baby on the slabs. You have to sit comfortably, keep the baby on your lap, then keep the head of the baby down. Then only whenever there is objects, it may try to come out. So do this actions repeatedly until the whole body is out. Okay, so every time when you finish 5 back slaps and 5 chests, again check on the baby's mouth. If object is already visible, you can remove it. But as I mentioned earlier, don't cease. You keep doing it until it comes out. Then there is a worse chance is that sometimes the baby become unconscious. In such situations, again, you cannot do this. You have to do CPR, infant CPR. Now, sir has already explained you about adult CPR, right? Same way you have to do for the infant CPR. But instead of doing with both the hands, you will use 2 fingers. Okay, with the 2 fingers, you will be giving compressions. So that is the last part of the infant choking. So this is about adult choking. So first we will show you a video, then we will talk about it. Okay. As you have seen in the video, this is the usual scenario can happen at any time of any one of us. No? We might be very much happier when we talk in groups, right? So we'll be keep eating, we'll keep talking, and sometimes when you are taking, when it comes to adults, while you're taking alcohols or with the snacks or all these things, there are higher chances that it may choke. So and even at the among patients also there are higher chances there. So whenever you see a person choking like this, so next the symptoms are like this: cannot speak, cannot cough. So if the patient is able to speak little words or if the patient is able to cough, first you have to do what you have to do. You have to encourage them to cough so that the body may come out. If not, then you have to perform this maneuver, which is called Heimlich maneuver. Otherwise, it's abdominal thrust. So here, whenever a person cannot speak, cannot cough loudly, makes the choking sign. So you must have seen how that person in the video is holding. This is called as universal choking sign. It's when we are clutching our neck with both the hands and patient will be in this leaning position. So which means sometimes patient cannot be able to, most of the time they may not be able to tell whether they choked or not. But by holding like this and you should be able to understand that this could be a choking sign. Okay, so immediately you have to perform this maneuver. Severe cases, discoloration also will be there. Bluish shade. What is the meaning that when there is discoloration around the lips, like a bluish color, which means that adequate oxygen is not reaching. So whenever you see a person like this, you will be asking, are you choking? You have to ask, especially when it comes to adult and with the different gender, you have to ask, are you choking? And the patient may just nod the head. So when they are just nod the head, you should understand that patient is choking. Then again, you may have to ask, can I help you? Then only you should be able to, because otherwise the other person also may be terrified what you are going to do. So you have to go in that steps. If the person nods, yes, tell him you can help him. Stand firmly or kneel behind the person based on the height of the person you have to. If it is the same your height, you can just go behind the person and you can hold the person and do the abdominal thrust. We will see it now. If you want to help a child, like maybe 5-year-old, 7-year-old, the height may not be appropriate. So in that case, you may have to kneel behind the person so that height will become easy for you to do the abdominal thrust. Make a fist with one hand. So how to perform it? I will just show you. Suppose if suppose ma'am is with the choking. Okay, so ma'am will be placing this thing and she will be in this leaning position. So I will be very well able to hold like this. So first what I have to do is I have to make a fist with one hand, okay, like this, and this thumb has to place here means above the navel and below the lips, okay, above the navel, belly button. So here I have to make a fist and position it like this, and with the other hand I have to make a fist, okay. So I'll be like this, and will be little laid down position, and then I have to make a forceful inward and upward thrust. We cannot make like this, it is very painful. So we will make this like this, we will do the inward, upward. So this also we have to, thank you ma'am. So this also we have to keep perform until the foreign body is out. This is called abdominal thrust. Otherwise, Heimlich maneuver. Okay, so we will be keep doing until the foreign body is out. Again, like as I said in the infant choking, here also there will be a chance that sometimes the foreign body may not come out and person may go into unconsciousness. Then we will do what? Cpr. Okay. Then last option is Cpr. We will be doing the Cpr. And try to shift the patient to the nearby hospital as early as possible. Even if you are able to survive the patient with this abdominal thrust or with the back loss in case of infant, you are supposed to go to the nearby hospital and to have a breath check, because we don't know that how much it is injured to the person. Okay, so that's about choking. So in infant, we have to use the back loss and chest thrust procedure. When it comes to child onwards, you can do the same abdominal thrust, but you have to adjust your height, and then when it comes to adult, you will go for this abdominal thrust. And one more is there, whenever there is pregnant ladies are there, you won't be able to give thrust on the abdomen. So in that case, you can do same procedure, but on the chest thrust. Okay. And in case of obese people also, sometimes you won't be able to wrap around the person. In that case also, you have to do the chest thrust. And if you are alone, no one is around, by using a chair, you have to do your own abdominal thrust. Right? If chair is there like this, means here you have to. So if I am alone, no one is there around, I only have to do this abdominal thrust like this. Same inward upward. I cannot perform it, it is painful. But whenever it is there, you have to do like this and you have to keep doing like this. Okay. And if I am able to cuff out, I should try that cuffing first. Try to cuff out, so it may come out. So these are the various options when you can perform. Okay, you can see this video. Thank you.
Good morning to all. Today, as you are coming in the morning, how you are coming to the college every day? Bus, then? Walking, yes. So all of us need to come safely to reach the college, yes or no? So, same way, when we come to the college, we need to reach the college safely. So, in case of victim also, we want to, we have seen the CPR, we have seen the stopping the bleeding. So, different procedures we have seen. So, when we finish this, bleeding is still there and you have done the splinting. So, what we have to do next? When the victim is still there, what is needed? Very important. You have given the CPR, you have tried the important. So then we can leave the victim there itself. So what is the next one? So we have spent time to do all these procedures. So we have to transport the patient to the where it is safe. So we have different techniques how to transfer the victim. Where the patient or the victim is injured, maybe the accident has taken place or the patient is fallen down from a tree. So different situations which cause the person to get the injury. So first what we have to do, so the patient we have to check what is the injury he has, what has occurred. Okay. So in case of spinal cord injury, how we are going to transfer the patient to the hospital. So what are the techniques to be used during this period? So first of all, see what are the signs and symptoms of spinal injury. So what are the symptoms we can see? There will be What are the symptoms when there is injury to the back? Whether you have seen any client or any victim? What will happen when there is injury to the back or the spinal cord? There will be pain will be there. Then mainly what will happen when the spinal cord injury occurs? Is not able to stand. It's then you can see that. Is not able to walk, is not able to sense that part. So the sensation is lost, then the loss of consciousness also can be seen in some clients with their injury. What are the symptoms will be? The other symptoms. There will be loss of sensation with which part is affected. Maybe it is hand, maybe the feet or the toes where it is affected. And also there will be loss of control of bowel or the bladder. Okay, bladder control will be lost in some points, and or the bowel control will be lost. And also there will be the position of the head and the neck. If the injured patient has got injury to the neck, so there is not able to move his head and the neck or the particular area where he got injured. So what we have to do when the injury occurs? First, what we have to do? We have to check for airway, breathing and the circulation. Then upon that decision, we have to call 108. Then we are going to do the initial examination of the victim. Then if it is the injury to the your head and the neck, then we can apply cervical collar. Okay, or we are going for the log roll movement. We are going to shift to the patient to the transport. Okay, so how we are going to shift to the patient to the how we are going to transfer him to the hospital. So we have some techniques. We need one person who is holding the head and suppose the person has got injured, he will lie down on the where he is affected that area. So if he has got injured on his left hand, that hand should not be used. So if the patient is not having spinal cord injury, you can use the other techniques. But if he is having any injury from the head and neck and to the spinal cord or to the injury is there, then we are following this technique. So this is the log roll method we are using, and here we have the head. One person who is standing is the leader. So he is asking the assistance of other three persons. They are the three rescuers. And first is the first rescuer who is holding the head and neck. So who with the both hands, but he should not cover the ears of the victim. And the first rescuer who is standing first next to the leader, who is holding his first hand, left hand over the shoulders, and the next hand with the hip of the person. And the second rescuer who is standing to the leader, next one, who is interlocking his hands with the middle of the chest and at the knee, right hand at the knee. And the third rescuer who is holding his left hand in between the both leg, knee and the thigh, and the right hand in the lower ankle. Okay, so this way they are standing, and the leader who tells the other rescuers to stay, when he say 1, 2, 3, turn, then they have to together they have to turn, and when the leader says 1, 2, 3, shift, then they have to shift the patient to the or the victim to that board. Okay, they have to place the board and they have to shift to that board without moving the head, neck, and the back. Okay, so this technique we should use before we shift. We have to check before transferring to the victim to the hospital whether we have to check any injury is there. So we don't know whether there is an injury or not. So we should not use any other technique. We just cannot use other positions which is taken by Mr. So only we can use this log roll method when there is spinal cord injury. Okay. So this is that about how you are going to safely you are going to shift to the victim to the hospital. Thank you.
Good morning, all. So, till now we have seen like if the patient has landed up into any emergency situation, how we are going to transport as man dead, like with the log roll technique. But the other techniques are there. So, like in case of emergency, like in the on the roadside, if the patient we don't have any log roll, we don't have the boat, but we need to transfer the patient safely to the hospital. So in that way, we can use different techniques like the blanket. The blanket can be used for transporting the patient, or else whatever materials we are having that we can use. So in this method, like we will be seeing, like in this techniques we'll be seeing like how we are just going to safely transfer the patient with the help of the other thing. So there is one thing like the blanket lift. So they have just used the two sticks and the blanket has been rolled around it, and it is seen that the people are just safely carrying the patient on towards that blanket. By using the blanket, they are safely carrying the patient and they are lifting the patient and they are safely transporting the patient. The Also, in case of if the patient has a severe head injury or the neck injury, we should see that the neck and the head should be safely safeguarded first, so that if any bleeding is there, we like internal bleeding is there, we may not know at the time of emergency. Like if internal bleeding is there, we should first prevent that, and we should first keep the patient's head safe, and then we are going to be using the blanket as improvised transport stretcher. Yes. So in this technique, there is a technique called as fireman carry. So in this technique, we have to we'll be seeing like how the patient is just lying down in the prone position. Means like we need to make the patient lie down on the chest, and the other rescuer is using this energy to lift the patient and make the patient lie down on his back, or make the patient support on his back, and he's transporting the patient. Or else we can use the tight hand throw. Tight hand throw means the patient hands are tied around the neck and they are making the patient transport from the injured area, like from the accident area to the hospital. Also, they have safely, they have rotated the blanket around and they are shifting the patient from by on the floor itself, they are transporting the patient. So we can see like how they have used the hands to be tied around the neck and they are making the patient crawl on the floor. Also, there is a technique called as back strap carry. So, as we are just placing our backs, so strapping around the back, and we have supported the patient by giving the support to the patient on our back. We are carrying the patient and we are transporting the patient.
Yeah.
Also, there are different techniques where we can use like one person arm carry or else two-person arm carry. So in case one person is available, now we are only single rescuer, how we are going to transport the patient? And mainly the patient who is very seriously injured.
One person arm carry.
Not going to use, because in cases of pelvic injuries or
Pramod
any
Kumar.
spinal injuries, we don't know exactly if you're moving the patient, it may land up into some complication for the patient. So some patients mainly who are having little bit complications, like in the case of fire, if there is an incidence of fire and the patient is just become unconscious because of suffocation. So such patients we can use. And in this, the person who is rescuer, and who is the victim, he should be actually considerably smaller. So the height of the patient should be smaller than the rescuer. We should see that, and he directly how we are carrying the patient, how we are carrying on the arms. So in the same way, we are going to carry the patient and we are going to transport the patient. Yes. Whereas when two people are there, we can even make more safer transport than the one man. In this, the people if the patient has got fracture and he is unable to move his legs, he is unable to move his arms, any fracture at the back or on the shoulder, that time we need to support. The one person should be standing at the front wherein he is supporting the legs of the patient, whereas the other rescuer will be standing behind, just holding near the they will be holding using both the hands, they are securing the back. So back support is being given, whereas extremity support is being given, and they are carrying the patient. Whereas this is the technique wherein they are supporting the arms also and the legs also. Also, we can just support the patient by using the two-person arm carry, as we have seen in the diagram. The two rescuers are going to stand at the opposite side, facing each other, and they have placed the arms. Both of their arms are on the both of their arms are resting on the shoulders, exactly on the opposite rescuer. The arms should be resting, and with the other arms they are holding one arm should be resting on the shoulder, whereas the other arm they are catching the other person's hand. And there is why they are doing that. One side are going to support the back, whereas one side they are going to support the extremity. So this way we can use in cases of support, if the patient requires the back support, if the patient is severely injured and if the patient requires back support, during that time we can use this technique even. So there is the difference, wherein we are supporting the arms and legs even, also we are only supporting the arms. So in this case, if the patient has got any injury on the only on the shoulders, we can use that technique. But whereas over here, if the patient has got a fracture at the leg or else on the thighs, so in that way we can use this technique. So these two techniques are being used in order to safely transport the patient, wherein some devices are not available with us. During that time, we have to be the rescuer to transport the patient from the road till the hospital. So have you all got how we are going to transport the patient to the hospital? Yes, we are going to safely transport the patient and prevent further injuries and give the immediate treatment so that the patient's life can be preserved. Yes, I hope so. Everybody has understood. So we'll be practicing the session also in the drill. So that time you will get to know it better, in a better way. Okay.
After the tea break, we will be divided into different stations for the hands-on practice. So I want the students should be in 4 groups. So can we start from here? We can count 1, 2, 3, 4. You say 4. Last one 1. 3. 2. 4. 4. 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. You are one right. 2, 3, 4. Just remember your number. That's it. 1, 3, 4. 1. You are 2. 3, 4. 1, 2, 3, 4. 1, 2. Teacher is 3, 4. 1, 2, 3, 4. 1, 2. Okay, so all 1 and 2 will remain in this form. Okay, 1 for CPR, 2 for bleeding control. That will be somewhere here we will do. And 3 and 4 will be in the next row. So 3 for choking and 4 for bleeding control. Here safe transport is there. So 1 and 2 remain here. You don't have to think about stations. 1 and 2. 1 will be here, 2 will be here, 3 will be at the entrance of the next row, and 4 will be this corner of the same row. Okay, 3 and 4 there, 1 and 2 remain here. Just remember your number. That's it. Thank you.
Yeah, quickly go for the break and come. Less 10 minutes. Before 12, at least we should start the demonstrations. Go and come fast.
Should be here, no, for this one.